Well, I could be wrong, but it looks like Sajid Javid is using the government's brain cell today. Let's begin. Now obviously recently we've all had to start staying in our houses because of a certain thing floating about in the air, and as time went on we understood a bit more about it, including other variants which came along. Now don't get me wrong, I'm in no way trying to suggest that this whole thing is over and that people didn't die, because unfortunately they did. However, with the new variants, it often appeared, well to me anyway, that the mainstream media seemed to create a lot of scaremongering by perhaps inflating the numbers with their whole within 28 days figures, rather than just giving the figures for a single day. Hang on, yes, I can hear you all now in the comments.
Yes, because it took them time to get the official figures. Oh, I hate the Smug one.
Well, in that case, couldn't they have just given the figures for that single day when they got them, rather than the whole 28 days altogether? Anyway, because everyone was indoors, queues for hospitals, appointments and driving tests and other things like that started to build up. But in an attempt to clear the backlog, Sajid Javid apparently is going to let us have private healthcare paid for the NHS, according to The Sun. Now, whilst that's obviously a good thing, I do think the government should pay some towards the private cost instead of just the NHS paying for it all, because no doubt Labour would actually probably capitalise on that in their next election campaign. I mean, can you just imagine it?
The NHS has no money, and it's all because of them Tories. I know I've said it in previous campaigns, but this is really, really your last chance to save the NHS.
Well, I don't know about you, but I'd rather date Gemma Collins than vote Labour. Oh, actually no, I wouldn't. Mr Javid wants 60% more patients with long-term needs to get personalised care by 2024. The plans will also see an expansion in the number of people gaining personal health budgets beyond the current 200,000 target. The allowances are handed to those with long-term conditions such as stroke victims or arthritis sufferers to pay for carers or specialist medical equipment. Well, hopefully this will actually save quite a lot of people's lives whose condition may have actually worsened by continuing to queue otherwise. Anyway, to be kept up to date, remember to click that subscribe button down there so you don't miss my next video.